You know, sometimes you don't need a cafeteria running 24/7, but you'd like to have a lot more than you can get from just a row of vending machines. That's where Foursquare's a micro-market concept comes into play. I'm Doug Allred. We'll tell you about this one and much more in this month's CodeVU. Providing high-quality health care sits at the forefront of Cone Health. Being familiar with and taking part in a quality improvement project is the goal of a new requirement for Cone Health medical residents. 4 teams of residents recently gave presentations on quality improvement projects they designed and worked on.
It helps them to look at the data critically and say, where do we need to improve? Where do we go forward to make my work better?
These internal medicine and family medicine residents spent the last 7 months looking at such things as better ways of tracking weight gain in heart failure patients to reducing the number of people who miss primary care appointments.
Be able to implement these things and looking at quality improvement projects and being able to take part in them, because those are important things for physicians to be a voice in, because we are the ones that are seeing these patients, and it's best for the patients' outcomes as well as for healthcare in general, saving costs and things like that.
The results will be looked at to see if the findings could be replicated throughout Cone Health. While no one expects physicians to become Six Sigma experts, constantly improving healthcare will be a major part of their future practice. High-quality care comes automatically to the inpatient rehab team at Moses Cone Hospital. The team has again earned a 3-year accreditation from the Commission on Accreditation of Rehabilitation Facilities. And despite changing benchmarking databases, inpatient rehab remains in the top 10% nationally when it comes to patient outcomes.
Actually, I asked the team the same thing, the same question. So what is it that you do that helps you to be top performers? And they all really pointed to teamwork as well, and their ability to collaborate, not only with each other, but also with the patient and family. So everybody here is a big team working to achieve those patients' goals.
For Cone Health Hospitalists, the key to improving care is thinking small. A year ago, they were providing better care at Annie Penn Hospital, which has a small number of patients over just 2 units. So the hospitalists worked out a way to group their patients in clusters at the larger hospitals to reduce walking and time away from patients and families.
Being able to just be right around the corner when another patient or a patient's family needs you, versus a nurse saying, I'll pick up the phone and try to see when he's available, or try to call him and maybe he can come later on. You're always going to get a better experience when the doctor is able to be there.
At Moses Cone Hospital, these doctors could spend 2 hours a day just walking between patients in faraway units.
It's healthcare plus love care.
Myra Johnson struggled. She had a bag full of medicine, didn't trust her caregivers, and faced times when the financial ends didn't meet. She was referred to Triad Healthcare Network. THN's community project provided gift cards to meet her urgent needs and caregivers who built relationships.
I'm managing my own medicines now, and they trust me to do that now, because I wasn't doing it, but I'm doing it now. And everything, my sales, everything is on track now. My life is on track and I love it.
The cards are paid for through donations and meet the urgent needs of patients.
So what is it that keeps you from going to your doctor every month when you need to? What is it that keeps you from not buying the food that you need or the medications that you need? And so we discover a lot of challenges by asking questions of what those patients struggle with.
If you're interested in donating to the THN Community Project, contact Fund Development. It can get expensive keeping cafeterias open 24/7. Enter the new micro market at Moses Cone Hospital. Register at the kiosk, then use your card to quickly pick up nearly anything from sandwiches to lasagna on your time.
It's much easier, much simpler. It directs you right to online if you want to check what you've purchased, your balances, and where other locations are located at, because this card will work anywhere throughout the United States.
The market sits inside the cafeteria at Moses Cone Hospital. Badge readers will let you in during off hours. There's a new 2-acre healing garden at Alamance Regional Medical Center. The garden is overlooked by patients in the Cone Health Cancer Center at Alamance Regional. Patients, visitors, and hospital staff can get some exercise going through the garden or just break free for a while.
It's the Serenity sculpture that was done by a guy named Matthew Plachek out of Omaha, and the sculpture is supposed to have and provide healing qualities for the mind, body, and spirit.
The $1.3 million garden was paid for through community donations. That's it for this edition of CodeVU. I'm Doug Allred, and I'll see you next time.